All right, ladies and gentlemen, Assalamu alaikum. Welcome to Pakistan Day Festival 2016, organized by Pakistan Link, Urdu Link, Arif Mansouri, Wakar Ali Khan, Samin Faruqi, let's see, Irfan Murtaza, Ismail Kiki Bhai, Zubair Rauda, Samir Musani, the whole big team, of course, Asad Qazi. And please forgive me if I am forgetting any names. I'm very proud to be here today and actually helping my cousin, who is the executive director for Indus hospitals, which are located in Pakistan. They provide free of cost quality care across Pakistan. They've got 8 different hospitals, and I've got my cousin Muhammad Abdul Qayyum visiting us from Atlanta, and here he is right here. So Assalamu alaikum Qayyum bhai. Okay, so I'm gonna have this is like totally out of the blue. I just thought of this idea. I thought it would be one way of promoting Indus Hospital. So I thought I would just create a video here with using my cell phone, and this is totally amateur. It's not like a professional video or anything like that, but so I'll go ahead and ask you some questions about if you can give us by the way, guys, we're sitting here at the Pakistan Day Festival at USC Exposition Park right here in Los Angeles, and there's of course, this is being downtown, so I hope you guys can hear me. So there's some helicopters flying over. Anyway, so go ahead and please give me an overview and background of Indus Hospitals. Who founded it? How did it begin? Are you guys the first hospital in Pakistan? I'm sorry, I'm asking of so many questions that I can think of. Go ahead.
Actually, it has been started by the philanthropists and the technocrats, volunteers. You name the person in Pakistan is involved in this institution. Of course, the institution started with a partnership of Islamic Mission Hospital, which was already working in that area, in the current area, and then there's a big team of professionals and volunteers who were working at Dom Medical College, and their institution was Patient Welfare Association. It started perhaps in 1982 or 94. Of course, I'm proud of part of this institution. I was associated with Islamic Mission Hospital, and of course I met this group in Karachi in 2002, and from 2002 we had about 2 years of agreement process going on, and then finally we decided to merge into one, which created the Indus Hospital. And of course, since then, since 2004 and now this 2016, in 12 years, it has made a tremendous progress to me because of the trust in the objectivity of this institution. They decided, the whole team is committed to make this hospital free. The supporters are putting a lot of money and energy. Of course, this is not just because of the money, but because of the commitment of the people who live in Karachi and now all over Pakistan. There are doctors, there are engineers, there are auditors, there are IT professionals, you name it, all is a team. It is very difficult now to really separate this institution or name it for any particular person. So this is one thing that is, as a Pakistani, we should be proud of, and we should be proud of, and we should, once we know about what this institution is, one would be completely sold out to go and work for this institution.
Absolutely.
Of course, not everybody can go to Pakistan and work for this. I moved to America last year, and I live in Atlanta, and I have put all my time to make this institution happen. Of course, this is a free hospital.
Free of cost, you mean?
Free of cost.
Free of cost to anybody and everybody.
Everybody. There's no cash counter.
So,
and one thing is very important. Let me complete it. Then, actually, we are collecting 2 types of funds. One is zakat, which is part of our religious belief, and the other is general donation. And it is expanded in a way that we cannot even think of. They start first year the budget was 10 crore rupees. In 10 years, it is at 3.2 billion rupees, which is sometimes it is unexpected how this can grow that much. But it is the confidence of the donors who have been seeing words of mouth. The whole Pakistan, and now of course it is known internationally from America also. We get something like $2 million every year. This just starting, but I think once the people who know what this institution is, how it is providing free service, which is perhaps not available anywhere in the world. Pakistan is one of the countries that we should be proud of, that is offering free hospitalization, which is a tertiary care to everyone without asking a question.
There you go.
All you have to walk in. There are white collar people who cannot afford it. There are poor people, of course, the poor again cannot afford it. But we do not discriminate. Even if somebody is coming from a middle class person and he want to have use the facility, he has to go through the system, and he would be given the
Free medical care. Free medical care.
And of course, one of the reasons perhaps it has grown that big in 10 years, that people have received the service and they found it to be something that to be spoken to other person, and now people are talking about this and people are coming and donating for this very objectivity. Now we have a lot of foreign participation, like we have Bill Gates
Foundation, okay,
which is participating in 1 hour.
Bill Gates and Melinda Gates, right? Sure.
They are participating for the
for the
research.
cause.
Yeah, research.
Research, even better.
Grants for the research now.
Wow.
So like there's a TB and there is a resistance TB. In Pakistan, we have maybe thousands of people dying because of the resistance TB, because the cost of medicine is so high that people can't afford it. So this hospital has provided medication for those resistance TB, which is
what is it called? I'm sorry, I'm not able to understand.
Resistance TB.
TB or tuberculosis. Okay.
Tuberculosis, yes.
Okay. Well, that's very dangerous.
Yeah, very unique.
That's very dangerous.
Because the cost of testing itself in thousands of rupees, and each day the medicine that is required is very expensive, and many people can afford in Pakistan.
Sure.
So it is with the collaboration of the international agencies. They are providing fund, they are providing medicine, but they wanted to make sure that it goes to the patient directly.
Right.
So we created a network of global mapping, where we go to the houses and provide medicine to them, and we make sure that the purpose of this program really works. And
right.
In our case, it's 97.5% success rate.
Very nice.
Whereas when Pakistan government was doing it, was only 46%. So
and how much is yours? 97.5% success rate in
Pakistan.
In Pakistan.
Because of the system that has been created, and because of the commitment that this Indus hospital has made to make this project work.
Absolutely.
And there's other programs, and you'll be surprised that now we have 8 hospitals in Pakistan.
So let me back up a little bit. When and where was your first hospital founded?
The first hospital founded in Karachi, Korangi area.
Okay.
That's the starting point of the Korangi.
Okay.
There are 2 roads which goes to Korangi. One is industrial and one is residential.
Okay.
So this 2.2 million or maybe more people live in that area, and there's no hospital in that.
Right.
This is this beginning of that corner of the, we call it Korangi. What is the name of the location? But anyway, this is the starting point of the Korangi. And because of our service, the government of Sindh and government of Punjab has given their hospital to us to operate them.
I see.
And they are, in some cases they are funding, some cases we are funding.
So they are providing the facilities, and you guys are providing the coverage for the medical services.
Yes.
Okay.
And on the same principle that there will be no charge on that.
Very nice. Very nice.
And no charge with medication and everything. Of course, our cost, and I would like to share with you, all the tertiary care. Normally, the tertiary care is very expensive because the hospitalization required 1 to 5 days also. Like if you have a heart surgery, it could be 3 to 4 days. If there's a stunt, if you are going to put the stunt, there are 2 days. All cost inclusive of everything that we do. The average cost for 160,000 patients that we treat every month is only $18.
Wow.
Which is amazing.
Really?
And anybody can afford it.
Absolutely.
And if by just contributing $18, what you're doing, you're just taking care of one patient of all the nature. Of course, there are costs which there's a cost of $10,000 per patient. There's a cost of $5,000 $5,000, there's a 2,000, there's 1,000, and because of the common cost and because of the support that we get, we have been able to run this hospital at an average of 1,800 rupees, which is $18.
Okay, okay. So let me ask you this. So going back to the number of hospitals, you said the very first hospital was founded in Karachi in 2002.
Actually, 2004 it merged with two institutions, and 2007 was the first day that we.
Sorry, we had a little bit of interruption. Okay, so 2004 is when the first hospital started.
2004, the merger was the merger came into between the Islamic Hospital and Rufada. But Indus Hospital took his first patient in 2007.
All right. Okay, so that was the first hospital. Where and
Now,
when?
We have now 4 hospitals in Karachi itself.
Okay.
Child and family center where we have the gynae department.
Okay.
We have one child cancer center in Federal area.
Okay.
One we have dialysis center in PIB.
Okay.
And fourth one is the main hospital, which is Indus Hospital.
Okay.
This is in Karachi.
Very nice.
And then we have one in we just started last month in Badin, and there are 4. There are 3 more in Punjab.
I see.
One is Lahore, one is Muzaffarabad, and one is in south of Punjab.
Sounds very good. Sounds very good. What is the total budget of your entire organization?
Last year it was 320 crores.
How many dollars does it translate into?
Translated to $32 million.
$32 million. And you got those $32 million out of all the donations that you have received.
Yes.
Eh.
The duty is 97% was received in Pakistan.
Oh, 97% of $32 million was received within Pakistan. And only
3% have been funded from the
only 3% was
We are not talking about those grants that we get for as a partnership with the other international institutions for a specific purpose, like TV resistance TV program, which is not the part of this $32 billion budget. It is only about the hospital that we are running.
hospital services, hospital and doctor services, including medications and what have you. Yeah. All right. So, what are your objectives to achieve in the United States or in North America, for example?
Actually, you see, we have our responsibility as a Pakistani or
As a Muslim.
as a descendant.
Or as a human being?
That is again one thing which is very important, because we are serving humanity without any discrimination or without any.
Yeah, there's no religion, there's no nationality.
No question asked about that.
All right.
But since it's been started by Muslims, we have one specific advantage that we get a lot of donation as zakat.
Very
There's
nice.
a zakat qualification requirement, so that we met. But so far the treatment is concerned, no question asked about who you are. You just fill the form, provide your information. Of course, we want to make sure that the person is really deserves that to get the treatment, because treatment is very expensive. So we have a filter clinic. We examine the patient who wants to get treatment there, and when he get through that department, then he goes into the tertiary care department. From there, we take care of everything without any cost.
Very nice, very nice. So anybody who comes from
Any part of the
even a neighboring country, you would provide them free of cost.
not as yet invited or provided any visa support system, but anybody who walks in, no matter from where, like Afghanistan is.
Okay, so however they are in the country, once they knock your hospital door, once they come into your hospital, and they are, let's say, suffering from cancer or any heart disease, any lung disease, or anything else, you guys would provide free of cost.
Presently, we do not have 2 faculties. One is neuro department, and second is adult cancer. We have child cancer department.
Okay.
So these 2 departments, we get a patient, we use our ambulance, and we send it to a proper hospital where he or she could be treated. So, but otherwise, rest of the faculty that we have, of course, we make sure that the person is genuine, because you see that it is very exposed by different type of people. It could be terrorists, also all these things. So
Yeah.
make sure we identify the person in the first place.
Yeah,
Sometimes
yeah.
people come from Afghanistan.
Yeah.
If he has a proper document, we'll
With
treat
bad intentions, and they may not be sick or
yeah,
what have
so
you.
that,
Yeah.
that is one thing that we do very specifically, because we receive donor from international agencies. So
Yeah.
that there's a requirement that due diligence has to be made when you are making treatment or making any contract with any other agencies. So that one thing that we do very good.
So when you send, let's say if you receive a cancer patient and you cannot treat that adult cancer patient, so
Oncology we do not have.
you don't have oncology services at this time. So you outsource
No.
the services to another hospital, or you refer to the other hospital? Who pays for those expenses?
Normally, what we do is we use our ambulances and take that patient to the government hospital. Because
Okay.
the other hospital who are paid hospital, they may not accept that patient, because we do not know the financial condition of that. Because we do not reimburse those charges if it is being paid
Okay,
anywhere
okay.
else. But if it is our place, there's no charge. The second thing that we do is we just take the patient and send it out to government hospitals.
Okay, so now, if do you have a target to set up oncology services as well?
You see, it is all the participation of the doctors and the donors who have so far been helpful to create all these departments also.
Okay, okay.
We actually we do not claim anything that we are doing anything special. It is all the support that we get,
Right.
financial support, technical support. When the doctors come and they want to do, they have families who want to create, but like one of the families in Karachi, Rangunwala family.
Okay.
They have created the lab and they have completely financed it, whatever it is needed. So we have no cost to run a laboratory in Indus hospital. Similarly, we have a blood screening department. Again, it is funded by somebody. So if somebody comes with the idea to put a oncology department, do it, because that makes the things easier. Because one thing we have to understand, the major cost of any operation as a corporation is the capital cost,
Right.
and then the land cost and the building cost. In our case, it is all donated.
Very nice.
That's why the cost of we are maintaining at such a low cost. We do not have the depreciation on the equipment or depreciation on the building and the cost of the land. All these things are not there financially. So it only costs us operational costs to manage the hospital.
Sure.
The salary of the doctors and all. But of course, it can be compared with any hospital in Pakistan. We pay the good salary to doctors, good salary to all the paramedics, and everything is paid in the marketplace.
Absolutely.
They are not doing welfare. Welfare is done by the welfare department, which is a complete separate ballgame.
Absolutely, absolutely. Okay, so what is your message? One last time again.
Very simple. People should first know what this institution is, because Indus is an institution. It's